Welcome to Biztech's Health and Wellness Show, where we focus on equipping you with the knowledge on health and wellness to help you to ensure that you have a more productive and healthy life for yourselves, your family, and your employees. Now, today the conversation is about healthcare access, which is something which has become more and more critical with the onset of COVID-19. Now, to bring expert insights, we have Roshel Jayasundara, the Senior Director, Global Consulting at Axios International. Now, welcome to the show, Roshel.
Thank you, Brian, for having me. I'm really happy to be here.
Now, give us an overview of what Axios International does globally.
With pleasure. So Axios International was actually established back in 1997, and our focus since then has been at a global level. How do we address access challenges, and how do we ensure that the right patient receives the right treatment on time? This has been really our driving principle. And what led to that is the fact that, for instance, back in the 1990s, when there was the HIV epidemic, there was a rush to get access to treatment. And all that could come up was nothing other than a donations program, right? Because there was a need to address things rapidly.
Yeah.
So thinking a little bit of that, what we did was then think of how can these models be more sustainable? Because providing donations, this is not sustainable for the pharmaceutical industry. It's not sustainable for the healthcare ecosystem overall. So what we came up with was really differentiation models, cost sharing models that look at how do we, first of all, provide access to treatment for the patients. But secondly, how can we follow up, continue to interact with these patients so that they really receive the best medical outcomes? So this is, in a nutshell, what we've been doing, I would say, over the past nearly 25 years at a global level and also here in Malaysia.
Okay, so could you give us an idea of some of the services that you offer your clients, your products and services?
Absolutely. So we work together with our clients who are typically your pharma MNCs. In twofold. First of all, trying to understand what is the access gap, what is the challenge that they are facing in a given country based on the dynamics, again, from a patient perspective. So we will work with them in designing a strategy, helping them also educate internally their stakeholders to, I would say, adapt these strategies. And then we actually implement these solutions. And I think this is really the beauty of what we do, that we transform something which is a beautiful PowerPoint presentation into a reality that actually impacts patient lives. And so we deploy what we call patient support programs, patient assistance programs, depending on the country and the type of unmet need. The focus and the objective of this program is to allow patients that live across low and middle income countries to start to access treatment and stay on treatment.
This all sounds really good and abstract. Give us some specific examples of how, and drill down as to how you work with your partner and then help patients.
Absolutely. So we would work with our partner, identify a market. Let's say we have Malaysia, and there is a specific therapeutic area where there is an unmet need. The partner would have a product that can address this unmet need. However, because there is an affordability barrier that usually comes with innovative treatment, simply providing this product from a commercial perspective would not enhance access, right?
Yes.
So what we try and understand is, okay, if we work together with an access program, whereby maybe the patient pays for a portion of their treatment, the rest is subsidized either by the pharma company or existing alternative pockets of funding such as NGOs, how many more patients can we actually serve? How long will these patients stay on treatment? And what would be the ultimate outcome? So this is at a planning level. Then we actually operationalize the strategy, as I was saying, where we go into market. We have teams across all of the markets where we operate. This is important to bring in the local context because there are cultural implications also when you're dealing with patients, for instance, or even physicians, and try and understand how can we map that journey. So from the moment that a patient has been prescribed this X treatment, right, how would they then be referred to Axios? So for instance, it will be the physician referring them to our program. how do we assess the patient and their capability to pay? And we have some tools that we have developed to do this. And then we follow up with each patient until they eventually drop out of the program.
Okay, so if I'm just thinking out aloud, one of the types of patients that you would help would be people infected with rare diseases.
Correct. Absolutely.
And because that's a big issue, and with rare diseases, some of these treatments are in seven-figure sums per annum, correct? Because of the scale of it.
Absolutely. And I think, rare diseases is an even greater challenge than the one that we've seen over the last few years, maybe if you think more about NCDs. And even in rare diseases, we've been working in this field, I would say, for the last 2 to 3 years, trying to identify how we can bring more partners, because in the context of rare diseases, it's not enough for the patients to pay for part of their treatment or the pharma company to sponsor some, right?
Yeah.
You definitely need 5, 6, 7 stakeholders together to support patients. And that's where the collaborative aspect of these programs really makes a difference.
Okay, and how long have you been in Malaysia, and what sort of work have you done in terms of improving access to healthcare?
So we first came to Malaysia in 2008 with a program that was addressed to help oncology patients mainly. So the way that the program worked was that there was a particular drug, the patients were referred, and through the program, the patients could then access treatment. We then came back, I would say, in 2016 with more innovative models looking at individualized cost-sharing solutions. So we now deploy in Malaysia patient assistance programs that rely on understanding the individual patient's ability to pay. We work with the patients so that they stay on treatment. And we've also launched our digital tools in Malaysia. So we are trying to bring all of the learnings across Axios to serve the local population.
Okay, so I want to ask you two things. One is in terms of the stakeholders that you engage in Malaysia, because we obviously have a dual-tiered healthcare system, which is one, essentially free, which is the public healthcare system, and the private system, which has significant healthcare inflation.
Yes, so the dual healthcare system in Malaysia, I think, is one that has evolved, I would say, over the years, and it's definitely acknowledged. I mean, when you think of healthcare system in Malaysia, you can see we have also medical tourists coming in. So that's right. a sign of a healthcare system that is being recognized as a leader, I would say, within the region. But the way that we have worked in particular is trying to help patients from both segments. So there are some initiatives, you have My Salam, PECA B40, and this addresses a portion of the patients. However, not often for more innovative types of treatment like the ones that we are trying to provide access to. So what we do is work with both sectors, public and private, obviously the physicians are the key decision makers on whether the treatment is appropriate or not. And then we work together with the patients. We've also partnered with the National Cancer Society of Malaysia to really enhance the awareness around these patient assistance and patient support programs, and also to provide adherent support to them.
Yeah, because one of the key challenges in terms of non-communicable diseases like cancer is the fact that essentially, according to WHO numbers, that makes up 74% of Malaysia's deaths and cost almost 9 billion in productivity losses every year. So it's really a significant chunk of our in terms of a loss. But do you think that healthcare access can be improved for Malaysians? Because for a middle-income country, we do have, by most measures, very good access to healthcare.
Absolutely. Yes, I think you do have very good access to healthcare at the present status, but there's always a little bit more to be done. And I'll give you the recent example. We've seen the collaboration between public and private sector in the rollout of the vaccine, right? So it's not available only in the public, it's available also in private. And this pandemic showed us that actually the collaboration between the two sectors is possible. So then my question is, why don't we take some of those learnings forward, right? So rather than continuing to perhaps build new infrastructure, why don't we leverage the existing infrastructure, existing capabilities of the healthcare practitioners to serve more patients? And another aspect, you mentioned the cost, the burden of disease from a financial perspective. One key aspect that we need to think about when it comes to access is not giving the patient a box. Access is beyond just the box, right? It's about the full treatment course. If we think of an oncology patient, for instance, if you give them you will see there largely in Malaysia, there are these buy one, get one free type mechanisms or programs. Yeah. But if I'm an oncology patient and I don't have sufficient ability to pay, I buy one, I get one free, and then I can't continue my treatment course. So not only have I wasted, quote unquote, my money, right? My physician's frustrated because I'm not getting better. I'm back to where I was, to square one in a certain sense. And that's where the longer term thinking of how do we enhance access so patients get the full treatment course is important, because if they manage to get the full treatment course, they will get better. They can go back to be productive from an economic standpoint also. And also we reduce the inefficiencies as a healthcare system.
So Roshel, I want to zoom back to one of the things that you just said, which is basically about the private-public partnership. So one of the things that has happened in the Malaysian context is, as you correctly pointed out, they're starting to really explore partnerships because of the pandemic that they've never done before. One of which is just a couple of days ago, the announcement was made that some non-COVID patients would be transferred to private facilities obviously at a special rate in order to free up hospital beds in the public sector, because the healthcare system is currently overwhelmed with COVID-19. But interestingly enough, as you said, and this is where a company like yours obviously will do the appropriate modeling, what is and you said this, instead of building new facilities, there's actually opportunity to utilize greater amounts of unused capacity within the private sector. And if you actually do a proper costing on it, it actually may be cheaper than doing it in the public sector.
Absolutely. And it goes back to the context of, I mean, as Axios, we're kind of wired to think from a patient standpoint, but if you're able to serve that patient faster, ultimately it's a win-win for all of the stakeholders involved, right? And also you're going to be utilizing, if we take it from a pure human resource perspective, you will be maximizing their current capabilities. They are seeing more cases on an ongoing basis. You mentioned earlier rare diseases. One of the challenges we have in rare diseases is that obviously you have a small number of patients and not enough preparation from a capability perspective of the healthcare system. But if we maintain what we have and continue to see more patients, this builds up a lot of expertise in country, and again, in my perspective, reduces potential inefficiency.
Now, I want to talk to you about technology. Again, because of COVID, we've had rapid adoption of technology in healthcare, which has taken a long time to actually, prior to this, have any sort of traction. So Malaysia undertook several initiatives. In fact, some healthcare providers like Sunway Medical Center started to provide telemedicine and teleconsultation services right at the start of the pandemic. Now, what do you think the role of digital healthcare technology is in terms of facilitating healthcare access?
From my perspective, digital obviously brings a positive impact to any type of healthcare access initiative. However, what's very important to note is that I see digital, and as Axios, we see digital as an enabler. There's often this confusion of, oh, you just have a digital solution in place, and then that's going to fix your problems. And I'll give you, in the context, for example, of telehealth monitoring or consults, yes, you can get access to a doctor, and now your physician will be seeing more patients, which is great. But at the end, we need to remember that we're talking about individuals, right? And there might be other complexities in place. As Axios also, I will tell you, we actually launched Axios Plus, which is our own digital suite of solutions during the pandemic. And Malaysia was the first country where we launched.
So what did you do? What was that all about? What was that initiative about?
So our solutions are targeted to different stakeholders. We have an app for patients, which allows us to connect with the patient on an ongoing basis, helping us to reach the patient again beyond just the hospital setting. But what we did, for instance, you have a way to reach the patient through the app, but if the patient doesn't interact with the app, we would call them. So again, a more personalized human approach. Likewise, on the physician side, what the app gave the physician the opportunity to do is to check the status of their patients throughout our programs at their own time, at their own convenience. So they didn't have to wait for phone calls or for email updates. They had, I would say, full empowerment and control over what's happening to their patients.
So one of the things which I think the pandemic has also highlighted is the fact that with technology, especially with the countries, middle-income countries like Malaysia, where we actually have a shortage of specialists, we may have enough doctors. Telehealth or telemedicine enables people in rural settings who have access to a doctor, but not a specialist, then to have better quality of care.
Absolutely. And I would agree with you, Brian. I think technology has played a big role also in the fact that you can have multiple specialists perhaps looking at a case. We've seen this happen in other countries, which improves the overall healthcare experience and patient experience. So I think that's definitely important. But again, I go back to digital being an enabler. Technology is helping us from a connectivity perspective, making things faster, but not quite replacing the human aspect that's important in healthcare.
I think that the visions of AI and robotic doctors still far away, but I think in terms of from a sensor and getting vital statistics and facilitating the doctor's work, absolutely, I think we're well beyond there already. But can I ask you, in a Malaysian context now, so for you as a company, you've had over 20 years of learnings internationally. What are you currently doing in Malaysia, and what do you plan to do in Malaysia moving forward? What are your new initiatives?
In terms of what we're doing and the new initiatives, so we have multiple patient assistance programs which support our patients in accessing treatment, overcoming affordability barriers. And we've definitely adopted the individualized approach, which allows patients to obtain that full treatment course that I was referring to earlier. We've then evolved from that, understanding that, okay, getting on treatment is important, staying on treatment is important, but what else goes on in the patient's ecosystem that can impact? So we have adherence solutions, more holistic solutions. If the patient needs, for example, peer-to-peer support, setting up workshops where they can interact with each other. These are aspects that we've included. Digital is definitely one of the new initiatives that we have brought to Malaysia. We've seen good uptake, and we're thinking of digital not only from patient or physician perspective, but also the hospitals themselves. So give them access, for instance, through our programs, we give products to the patients, right? So this is dispensed often by a pharmacist who is already very busy. So how can digital help their life? These are all the types of initiatives that we're bringing to the country, and our vision for the next years to come is definitely to continue to expand access.
Now, Roshel, any final thoughts before we end the show?
I would say, again, I'd like to reiterate that access to healthcare goes far beyond just getting a box to the patient. We need to take the patient into the equation when we're designing these solutions and focus really on the longer term, the treatment course, because it brings benefits to the patients, to the healthcare system, both from a sustainability perspective and expertise perspective, and it's a win-win for everybody.
Now, Roshel, it's been a fascinating conversation. Thank you for taking the time to be on the show.
Thank you very much, Brian, for having me.
Now, I'm Brian Fernandez, and I've been speaking to Roshel Jayasundra, Senior Director, Global Consulting at Axios International, on Biztech's Health and Wellness Show. This video will be on our Facebook and LinkedIn sites, as well as our website, www.biztech.asia. Please like and subscribe to our various platforms. Thanks again for tuning in.